Hey there, Tom Hulst from Hulst Jepsen Physical Therapy, and this is Tom's PT Tips. For today's tip, I want to talk about the role of stretching in dealing with low back pain. A theory as to why low back pain develops is because we have stiffness in our hips, and we compensate for that stiffness by moving more through the spine and creating instability in our spine, especially at L4 and L5. The three main muscles that are prone to tightness in our hip area are the hip flexors in the front of the hip, the piriformis muscle, which is a deep buttock muscle, deep to your gluteus maximus muscle that we stretch with a crossover stretch, and then the hamstring muscles on the back of the thigh. We'll be showing stretches for each of those three muscles. The other stretch I want to show is a backward bending lumbar spine stretch, an extension stretch of the spine. We bend forward up to 2,000 times a day, and when we bend forward, if you look at this L4 disc, we bend forward, we pinch on the front of that disc, which wedges the jelly. There's a jelly inside of that disc to the back side of the disc. It weakens the wall. You can get disc injury on that back corner. You can get bulging disc, herniated disc, which pinch nerves behind that disc. A lot of bad things can happen when that jelly starts to move backwards. So occasionally during our day, it's healthy to bend backwards to wedge that jelly back toward the middle of the disc. So these stretches are beneficial toward getting stress off your back. A couple weeks ago, I showed core strengthening exercises, which are the most important thing you can do for your back and the only thing research supports long-term. But adding these stretches into the mix is going to help you live with a more pain-free back. Let's roll the tape.